welcome to a very special series called Building Equitable, Thriving Communities. Our series will explore the ongoing journey in Northeast Wisconsin to co-create equitable community well-being through candid conversations about our collective triumphs, setbacks, and opportunities ahead. My name is Natalie Bomstead, and thank you for joining us. During our last episode, we dug deeper into the difference between equity and equality, defining thriving, and began a conversation around the impact of COVID-19 on health equity. Today, I am happy to be joined once again by two incredible people and partners in this work, Robin Scott from We All Rise African American Resource Center and Saeed Hassan from COMSA. Welcome, Robin and Saeed.
Thank you.
Thank you.
Last time we talked about COVID-19 and how it created additional setbacks for folks in our community who are already experiencing health inequities. Today, we want to talk about a few ways in which our community worked together to support equitable health outcomes for all people, especially those within our African American and Black communities who are experiencing some of the greatest disparities during this time and continue to experience some of those greatest disparities. So let's get started. Robin and Saeed, can you help us understand what was happening at a community level as the COVID-19 vaccines started to be rolled out, including, perhaps sharing how they were perceived within your communities?
So in the first place, first of all, thank you so much for the opportunity. Good morning to everyone out there. In the beginning, it was a kind of a shock wave for people to see what will this vaccine comes with. A lot of myth out there. Social media was carrying a lot of myth with different languages. So the community consumed, as you know, they say lies run faster than the truth. So a lot of people just consumed the lies and the myth, and they, so to speak, said no to the vaccinations. So as an organization, as a leadership, we took a stand to demystify that myth. We went to CDC website, we brought all these local resources together, Brown County Public Health, the local doctors. Dr. Rai was just forefront in giving us a lot of messaging. So we brought these messages together and created a language that is very much digestible to the group that we represent. And through various engagement and through consultations and working with the local communities, for us, the local charges, the mask, the small businesses owned by the foreign, by people who came from outside of the country actually helped us to bring these people to trust the vaccination, so to speak.
Thank you.
Yeah, so for the African American community specifically, what I saw was there was a lot of mistrust, mainly around the fact that it was new, right? Newly developed, and historically, within the Black community, we feel like that things that are tested on us. And so there was a lot of mistrust. And I think in order to talk about like what was happening there, we have to recognize like the things that have happened like in the past. And so there's historical mistrust between the Black community and the healthcare and other systems. And so there was just a lot of fear around, what the effects of the vaccine was. There was a lot of misinformation too that had circulated that gave way to more fear. But there were some folks that had already felt confident in what was necessary because there were so many that had experienced the impact of the death toll that rocked our community, not just here, but nationwide. And so I feel like at our agency alone, like in our community, things were pretty split. In the beginning, even as a staff, we'd seen most of our elders feel most comfortable at first with getting the vaccine. And there were a lot of, some of the more younger folks were not comfortable. And so they just had a bunch of questions, you know. And I think that even still to this day, like some of those things are not answered, right? And so, yeah, I think that we were pretty split.
Thank you. Thank you for providing that perspective. And, you know, as a vaccine then became even more readily available, you know, we saw some of those similar disparities really emerge around access and ultimately around vaccination rates. And in Brown County, we noticed in particular, two of the communities you serve, the African American, Black, and refugee populations, you know, had lower vaccination rates than others across our community. And, you know, I think at that time we had, you know, our public health departments and our healthcare systems that were really focused on getting the most people vaccinated as possible. But really what emerged was this need, right, to have approaches that became more tailored, that were more cultural, that made room to talk about the historical aspects that really have rooted the hesitations, right? Those historical injustices, and having these opportunities in places where people felt seen, they felt they were in relationship with one another, and they felt trust. And so, you know, both of you in our last episode, you mentioned how, you know, your culturally specific resource centers really became an integral part to that COVID-19 kind of that emergency response, right? And so when vaccines did become available, what were the conversations like and feelings of folks you were serving through your agencies? So you kind of, you know, you talked a little bit about those hesitations, but, you know, when they were now here and we had these kind of mass vaccination clinics around our community, did that change the way those conversations were happening, or did more questions emerge?
So I think it was a combo effect, right? I think that I know that we really focused on informed consent. And so we wanted to embrace, you know, like the truth that was necessary, right? And so what is the truth? The truth is that people, like, they want to belong. They want that social connection. They also want to talk about and share with others what they're feeling, what their fears are, and move to a place of comfort, but not like in a silo. And so what we did was we really focused on representation. And so making sure that there were other Black and Brown leaders that were, you know, had received the information and were disseminating it to others to get in front of our population. And so we were, you know, multifaceted in our approach to getting out the information to the community so that they can make the decisions that was best for them and their family. And so never did our agency take the approach of telling people this is why you must do this. You know, you don't bully people or scare people into submission, you know. That's not love, and that's not solidarity, and that doesn't lead to long-term solutions. And so we really just committed ourselves. One, I knew that in order for us to be of support to the rest of our community, I had to gauge where our staff was beyond those first opening weeks and all of that, like speculative and beginning conversation. And so we got ourselves in front of experts that looked like us. And what we've seen go from like 2 out of 13 people went to like 9 out of 13, and then like 12 out of 13 that got vaccinated. And when you're out in the community serving people at the grassroots level every day, your word is bond. Your word means a lot to them. And you being able to go with them or participate in something like this, where there's that fear and mistrust around it, it means a lot. And so by equipping those that serve and are working alongside others in community, we were able to get a lot of people that, you know, shown more interest, had more questions, felt safe. And so whether they participated on site with our clinics, or they decided to go to Walgreens with a family member, or to their doctor's office, we've seen a shift.
So for us, it was more about removing the barriers. The language was a problem. The cultural aspect of it also comes with, we had to also, as my colleague Robin said, look for folks that looks like us who can be able to speak to the truth and try to bring the community together. I remember when we first had the first, shots, it was when we were emerging out of the COVID-19, and for the Somali community, Ramadan was approaching. And, the message was, if you want to come back to the congregational prayers and want to be at the mosque, come and get your shot. And the first among us who got that shot was myself and Imam Hassan and, Adam, who was also a leader in the community. And when these people saw that we are getting the shot, that was just for them to say, okay, let's live together, let's die together. Let's have all those shots. So that within that first day, we vaccinated more than 70 individuals. So that actually, brought us again back to the next cycle. Like, how are we going to convince people who are also the other side of the spectrum, not going to understand easily, not very hesitant, and that about women more specifically, and also youth who are reluctant enough. So removing the barriers, but also bringing trust within the system was one of the things that actually made us go through that period of the COVID-19 vaccinations.
And I appreciate you both really kind of sharing kind of your unique perspective on the folks that you each serve, right, within the community, and the unique things that we intentionally need to think about as a community on how do we best serve each individual. And we talked last time about equality versus equity, and I think how you each really think about the unique needs of the folks within your community really speaks to that equitable-based approach, to make sure people are getting what they need in that time that they need it, right? And really, speaking to, some of the language barriers, right? And some of the hesitations, and really needing to allow that opportunity just for people to talk about it, right?
Absolutely.
And I think that was, one of the things that was difficult during that big push to get vaccinated was people had a lot of questions, right? And so where were those spaces that they could go and they could ask, and they didn't have to feel afraid to, there were no silly questions, right? These were, if you had a question, each question was valid, right? And to have that space. So I appreciate both of you really creating those spaces within your agencies and within your broader networks, because it's really important as we think about moving forward. One of the things that we were able to do together in response, so Wello, We All Rise, COMSA, we had this opportunity to participate in a new collaborative effort that was happening across the country, and it's called RISE, which stands for Reach, Immunizations, Systems Change for Equity, kind of a mouthful, so we're just going to call it RISE. And this initiative, which has been made possible through CDC funding mechanisms, really was really targeted to this approach. How can we, on the ground, provide resources to really improve equity, really resource and build up our ability to support those most impacted by the pandemic? And so the result here in Brown County was a series of co-created well-being clinics, and you started to mention those clinics, held really on-site at your agencies. So the clinics were kind of the end product. But what I would love to do with you both today was really help our leaders understand, or not our leaders and our listeners, really understand, how did we get there? What did people experience when they were there? And how can we leverage the things that worked and the things that didn't to showcase what is possible when we work differently together to really build that equitable, thriving community? So I'd love to kind of deconstruct with you a little bit those clinics to understand the impact. And so to start, let's talk a little bit about the intention. So kind of like the planning phase of these well-being clinics. So Robin and Saeed, can you set the stage for our listeners on how this collaborative was intentional on the who, the what, the when, the where, and the how of the well-being clinics? Saeed, I'll have you start. And I know specifically you talked about when we were doing these, this was during Ramadan. So I'll let you answer that question first.
Yeah, so for us, creating that space was, an opportunity for others to come together. So the way we framed the messaging in the first place was, who doesn't want to come back to the normal life? We all, found it for, like, we missed coming together, came from very communal background. Our culture is sharing and togetherness. So how can we come back to that, culture or that space again? So, and then our office became 7 days. We were operating for 7 days a week. We were not closing our office to make sure that individuals could be able to access the resources they need. If you look at the devastation of COVID-19, the way it have, something we were common with everyone. And it was specific things that we were different from the rest of the group in Green Bay. And that was social cultural barriers. You cannot be able, if you can't read the letter that comes to your mail, and you have to, one way or another, make to COMSA office to understand what that means. Mostly our people were working in the factories, and they were the most hit-had kind of a group. And then so we were be able, through the CDC, RISE project, be able to make them like an opportunity to vaccinate them, but also to give them the hope that they can come again to a center where they trust and get the resources they need and the vaccination they need. And then our organization also came through the unique, perspective that we have to use various channels in order for them to educate what these CDC, informations are in terms of vaccinations. And then we tried to make sure that this became a language that people understand. Then what is this, what is it, what does that mean? What is the vaccinations all about? How is it going to help them? And from there on, after the vaccination, what is the next prospects of their life? So we created that kind of a picture for them to see this is an opportunity and it's going to come by and it's readily available, it's free, and with, mixture of that, cultural food in it. So that was an opportunity for the community to get what they wanted in a very easy way, in a manner that they can be able to talk to me, to talk to Adam, Said too, and Muhammad in a very easy way. So otherwise, they couldn't have had that opportunity if they walk across the road to go to the pharmacy. They needed someone to help them with translations, but their translations were readily available. So I think that was what make these opportunities accessible and available to the community, and that was through the CDC. We would like to say as an organization that thanks to that grant, and to us that grant was a testament of how when the system comes together and understand the needs of the local community, how these needs can be eliminated using a traditional or a grassroots level organizations like us, and we all rise as well. I think this was a great opportunity, and we look forward to things like that going forward, because this is just, COVID-19 was the testament, but we have a lot of other things to get to.
And one follow-up for you, Said. So you talked about sharing that message in places where you knew community members were listening. Can you share a little bit about what one of those mechanisms was?
Yeah, so we used all model methods of communication and all channels of communication. So one of it was the TV that was mostly widely watched by, for example, the Somali community, which by the time comprised of about 95% of our clients. Thereafter, we had the Afghans, and now we have the Ukrainians and Congolese. But those were the channels that they used. We used Snapchat, we used Facebook, we used all these channels, looking into the generational values. I'm a Facebook guy, but someone younger than me may be, TikTok or Snapchat. So we used all these various channels in order for us to reach diverse, diverse audiences.
Yeah. And I think it really was a testament to how connected you both are within the community, and how community really works to spread the word. I remember being at the clinics and Muhammad calling people up, right? You calling people up and say, hey, come on down for a warm meal. And we also have some other things here, and come down for community. And I think as these initial clinics were really rolling out, obviously we wanted to keep people safe. And it was for some folks, the first time that they were able to connect with a broader group of people after some of the initial really large, shutdowns.
Yeah, absolutely. Communication is a glue that binds people together. I remember they were calling us, telling us, hey, what information can you give us? Like, is there any information? Besides these vaccinations, we used to give them other information that's coming from the state of Wisconsin. This is what's happening in the state of Wisconsin. So we became like a media house of its own, like we never realized we were. So yeah, that was an opportunity. And from that day on, I think we were also trying to get into the community to give them that information, any information that comes through that's relevant to them. We are sharing it with them through various models of communication.
Thank you. So Robin, similar question for you. What does it mean to be intentional around building capacity for an initiative or a project like this?
Absolutely. So I really did appreciate this funding from CDC Rise in particular, because it took the approach that we're used to, which is this very top-down approach, and it turned it into like an effervescence. And so it started and centered itself in community. And it centered itself in the people that were most impacted, being the ones that helped to develop and to frame the messaging and their needs during this global pandemic. And so the who, what, when, where, it was those that are most impacted, those that we knew were working in some of the larger industries that were most likely to have some of those underlying health conditions, those that did not necessarily have primary care physicians. And even when they did, maybe not have, would be a part of the group that would be most likely to feel like they've built a trust and relationship with those individuals, those of high transients. And so they're moving in about the metro area, across the interstate. And those that were most vulnerable, most likely to be on public transportation. Those are the folks those were the who. And as we started to think about how do we get messaging out to the who, how do we connect with them, we were able to ask them because we were open as well throughout the pandemic and serving those that are most vulnerable. And so one, just by being in community, by regular virtue, you're able to hear the conversations and the concerns very naturally when you're asking them, how can I help you? What are some of those other things that you need? But then also being very intentional about specific to the vaccination, the potential to have clinics, what would you be looking for? But then what would you be looking for that would attract you to some sort of event as such? But then using the things that we had learned already by doing work as a African American Resource Center in this community. And so we put all those things together, and asked the staff to be intentional about continuing to gather feedback throughout the entire process of what was better. So some of the things that we knew and were intentional about is that particularly in the African American community, they like to know and have it spelled out that this is an event for them. Right? And it's not about segregation, it's about celebration, right? And so we know that marginalized folks, those that are typically most disenfranchised, they will continue to feel excluded if we are not intentional about including them, right? Yes. And so those that are a part of the group of those that are most privileged, you never have to think about whether you feel included because every other place has already thought about that, right? You go into doctor's offices or you go into community centers and still you see white women, white males, white children, white families, right? You see things that are part of predominantly white communities, things that they care about, right? Things that they're invested in. You oftentimes will not recognize that most often in our communities, you see images that are not images of thriving or images of love and images of family, which in fact we know the data in our community, that families are together, and that, even with all the other barriers that exist within the world and the oppressive states, right, that families do what they can to do their best. And so we wanted to really destigmatize some of the imagery of the African American community and family, and so picturing people together, doing things that, when we talk about the historical mistrust that's embedded within the healthcare system, where do we start? How do we undo that? And some of that is being intentional about the imagery, picturing Black men and elders and young people alongside Black doctors, with hijabs on, and, with afros and with braids, and like just being really intentional about the imagery that we're putting out there. How we're talking about it. What does the flyer say? Is this language that really catches the attention of our focus population in our community? And then what is there, right? And so we brought out Black businesses that were local. So homegrown businesses that we're all very used to being out in community, that we know is a young, beautiful, strong Black family with this favorite brand. Yeah. But it's also like, organic products and things that are natural and good for your body and skin. And so we were very, very intentional. We had our food truck out, granny cooking, typical soul food items and meals, so that we're able to feed folks that came out. And then we're able to spread out across parking lots and inside the building. So we opened up all of our units and used space effectively so that people could feel protected, but also feel like they're in community and they're a part of something, right? We, had the purveyor signs all out and on the corners. So we could say, something that typically doesn't happen. We're used to going up, right? We're used to going over to the hospital and up the elevator and over to your doctor's office. And we're not used to seeing them come down, come out to community. And so that increased visibility and that combination, it was really powerful, and being intentional in that way. And then we also added in fresh produce, locally, organically grown produce from our farmers that are here in Wisconsin, to the event. And so that gave people, regardless of whether or not they got vaccinated, that showed people other avenues to wellness, right? And that includes the social aspects of wellness. And so come out, be together, be intentional. I think we showed solidarity as a group. You all had your staff out and on site and of service to other people at the event. And Purveyor had their staff out and of service and information gathering to other people, and also to give the vaccinations. And then NWTC was able to bring out some of their diverse nursing students to be able to be intentional about answering questions and concerns that people had. And so that combination effect was ever so important. And then I also think seeing the other systems and community groups and how they paired together was also very important. We have to remember, like, as we reflect back on the time, for some people it feels not that long ago, for some people it feels very long ago. But I like to recenter myself right back in it, Like I said on the previous episode, let us never forget, And so by going back to, being in that moment with people, like vaccine or no vaccine, people were terrified. People had lost already so much, and they wanted to look to the future, but there was still this fear. Will this world ever be the same again? Folks had never experienced anything like it, And so we wanted to be intentional from jump about like how we were going to connect with people, how we were going to provide follow-up with those same folks, and how we could be present in the moment. And so while a lot of stuff likes us to think at what is the bigger picture, we knew that, that was here. And what the bigger picture was for our community was that herd immunity, so that we can get people back out, right?
Yep.
But in order, sometimes you have to be able to focus on that, based like as community leaders, but really, really be intricate and intentional about how you do that within the people that you serve. And so all of that was not this get to herd immunity,
Right.
It was all about come out, be, ask the questions that you want to ask, eat, celebrate, be in connection with other people, see the hospital, see the system come to you,
Right.
So that you can see yourself reflected in it. If you are in fear, ask to hold a hand, So we'll see pictures of people crying, and we see pictures of, across generations holding hands and support. We had elders on site sharing stories about their own experiences. And so it was that multifaceted combination effect that really is what we experience with that, how are we intentional?
Yeah. Beautiful. It was a kind of a we are here moment.
Yes.
Right.
And we together, and we sticking together. Yeah. Right. But that saying was that you had,
Ubuntu, yeah.
Beautiful. So to kind of double click on some of the things that both of you mentioned, as we thought about the intention behind these clinics, it was important. One of the big things you mentioned, Purveya coming on site, at that time, it was still go to a site, right? And so it was very heartening to see a clinical group, recognize and understand how meaningful it would be to be on site, even if it wasn't the easiest thing to do.
Yeah.
Because part of the intention was the when of these clinics, right? So they were later in the evening, they were on Sundays, because that's what worked for community. And so, having that healthcare come, and also to recognize at that time, traditional vaccines, you had to sign up beforehand. And really, sharing with that healthcare partner, no one's signing up.
That's not gonna work.
That's not gonna work.
Yeah.
And that's also not the requirement. And so to come on and to really embrace the community aspect of this, I think was really important, and a lesson, hopefully, that we can continue to learn from in terms of really meeting community where they're at and with what they need. We talked about how we had nurses on site, right? We had a nurse that spoke the language,
Yeah.
right?
And also for us, it was also Bell Health. That was very much very supportive and trying to bring also all the resources they had to our organization.
Yep.
That was also very, very grateful for them.
Community health worker, correct?
Yeah, we share a position that's community health worker, but beyond that,
Yep.
I recorded a video with Dr. Michelle Menical about COVID-19. The referral was very easy. It was seamless, so to speak, integration with their system in our work that we needed at that time.
Yep.
So both Purveya and Belen actually played a very crucial role in supporting our organization.
Beautiful.
And the community, yeah.
And one of the other things we talked about was really purchase any of those products that we wanted to purchase, and really thinking about how can we purchase from Black-owned businesses here, as well as local businesses. And I think one of you really mentioned kind of how this funding mechanism was really a trust-based philanthropy type mechanism, meaning here are the resources, we know that you all know best, and here's the goal. How would you do that? And I thought that was a really beautiful thing for really allowing, as things popped up and as things were needed, we were able to pivot very quickly, as well as really make sure that those dollars were reinvested in people in our community, which is another aspect of really growing well-being. And then I always just said, down to the Band-Aids, right? So one of the things I know from a Wello side, we said, we need a Band-Aid after you get a vaccination. Band-Aids are Caucasian colored. They're white.
Yeah.
So let's get Band-Aids that look like the skin color, right?
Yeah.
So just the intention of really thinking about all aspects
Absolutely.
of an event, and I think, sometimes people call them details. Sometimes they're the biggest piece
Absolutely.
of that. Like details matter.
Yeah. People that are in survival mode, you know, like we don't recognize until we're around large groups of people that are disenfranchised, how, you know, detail oriented they are, you know, like what they'll notice in a picture versus what the everyday person will pull out in a picture is very different. And so one of the things that I've noticed by working with you know, our focus population, and to be honest, working with the most marginalized across all races and community members here in Green Bay, like they are very, very detail oriented and they care about those little things. And when they notice them, it you know, it makes all the difference in the world. It's like you see me reflected, and when they can see themselves as part of something, you know, they can be invested in it and they can help it to go further. So that's really important.
Yeah.
So next, let's dive a little bit deeper into the community-centered, like the actual experience that really acknowledges the historical trauma and mistrust in modern healthcare, especially within the Black and African American community. You know, part of this, as we mentioned, was really intention around, you know, who was there, ensuring we had cultural representation. You know, it was also around the overall experience. So we talked a little bit about this, but I wanted just to go a little bit further here. For example, at these well-being clinics, we wanted to provide people with warm meals. Right, and at We All Rise, you talked about how Granny was cooking soul food out of the food truck, and at COMSA, we were able to source and provide a locally prepared halal meal, which was delicious, as well as the tea. I want to mention, I got to give the tea a shout out because the tea was fantastic. You know, and I think through some of these efforts, you know, food insecurity, you know, meaning not having enough food to feed your family, really, we saw that increased during the pandemic, and that really, with inflation and all the other things that are really coming together right now, that continues to be a major kind of need and barrier in our community. So at the well-being clinics, people were able to just come and to pick up a bag of that sustainably grown fruits and vegetables, as well as some of those staples, right? Like eggs and honey. I think we had some syrup there at one time. And these were purchased directly from our local farms through Seasonal Harvest, which is a food hub that prioritizes small veteran and minority-owned farms when filling their orders. So we mentioned food here a couple of times, the warm meal, the food to take home to families. When you think about food, you know, why is food so important, do you think, when thinking about health equity and thinking about kind of well-being?
Yeah, food is everything. Food, I think, food brings people together. Food is medicine. Food is cultural, and food is a way to communicate with others. Like, for example, within our own culture, we have to bring people together and feed them in order for them to have that conversation. So food is just also a way to solve issues, solve problems. So with that culture of being togetherness and sharing, so food is about sharing that, you know, precious moments, and so for us, I think with this, you know, if you look at the population we serve, very large families, maybe one or two individuals working, they are very below the poverty line, and for them to have that kind of produce boxes, to have those extra food items available to them, was an opportunity. And during COVID-19, those individuals even lost their work because they were working in the factories, and those are, you know, they were, you know, told to leave because that environment wasn't conducive for them to continue work, and they never had any, you know, optional virtual or remote work. That doesn't exist for. I think when I say about remote work, it only exists within individuals with education. So those without uneducated individuals cannot be able to work on remotely. So when you're working in a factory, you either have to be there or you are not going to be getting paid. So it's an hourly hourly wage. You have to be there, do this hard work, which ordinary Americans are not doing. And then, so for us, having that food available to these folks who are very much in need of the food was an opportunity for the group. And where will that leave us then? Are we going to see, was that the only time that these individuals needed food? No. We continue to see food, need of food to this day. And the partnership between, Wello and us, three of us, actually, and Casa Alba, is to make sure that we have those, food or produce boxes available to those who in need the most. Will that suffice as the need? No, but that's just, one step towards saying we can provide to those who are below the ladder of the group. Maybe those with that larger community, family members, or those who lost jobs, and on those kind of groups who are sometimes, in the words of United Way, in the Alice group, so to speak. So these are some of the things that actually helped us bring food into the conversation during COVID-19, and helped us bring the hot meal, bring the produce boxes to folks that is going to be, who are in need the most during the time. Let me stop there.
Same question for you, Robin.
Yeah. So I heard this quote, and it said, how did it go? It said, eat your food. Wait, it said, my brain, it's freezing right now. Hold on, it's really important. I was all in tune with you over here. I gotta catch this quote in my head because it's really important. Said, is it eat your food as medicine, or one day you'll eat your medicine as food? Yeah, so who said that? I think it was one of those rich guys.
Probably. But it said, Bezos, sure.
It said, eat your food as medicine, or one day you'll eat your medicine as food. And so I think that's the answer to your question. It was really important for us to be a part of creating long-term or cultivating long-term change for our community. And so it's not that people, within our focus population are at the grocery store with these produce all the time. But what we do know is that in neighborhoods, there are food deserts in neighborhoods that are under poverty guidelines, or what do they call them, in the hoods and in the ghettos. They have been intentionally created spaces where there are more liquor stores than there are grocery stores, right? And then even within the grocery stores, those are items that are more boxed items, more items that have been, longer shelf life, more preservatives, all of those things. And so there are many people, you are what you have grown up around, And so if you've grown up eating that, you're gonna give it to your children, right? Even when you are in another community that you don't necessarily have to do it, right? But even here, we don't have enough health food stores and enough access to locally grown produce, Everything is really mass production. And even within our farmers market, for those that are marginalized, they don't always see themselves as accessing the farmers market or being a part of that community of people down there. And then that's even because of our weather. That's only a certain amount of times of the year. So there's trends of people growing and having the conversation about eating healthier. But to be a part of being able to do that for people and introducing folks to different varieties and different colors, it gave back good energy, It started and sparked conversations that have continued up until today. Folks were juicing and, around our offices, around community. We've seen in the beginning, people are like, what is this? All the way to now, it's like, where's my bag of, locally grown goods? And so it, was really it has been really amazing to introduce varieties. And so I talked about in the beginning of our initiative with the fresh and locally and organically grown produce, that this was something that from the motherland was a part of African culture. And the reality is, after we were kidnapped, brought to this land, a lot of that culture has been lost, right? But even those things that are lost are still a part of your DNA. They're still a part of who you are. And so during times that Black people were held hostage during slavery, they were made to eat the turnips, which were a part of the leafy vegetable and greens that were left after, the more desirable portions. And so I've seen my people and my history make really incredible meals with what was left, right? And so that has been passed down. What we know is that has given way to this phenomenon of greasier foods and foods that are not so healthy for you in the long run. And so there's this trend, community-wide and just on a larger scale of like, how do we do soul food in an even more healthier way? How do we unlearn and relearn some of the things and still not lose our culture? Because while I get to learn more and get to teach even others about traditions that I've learned about from the motherland, the reality is, our ancestors built this land. And this is a part of our history. And so how do we take what we've learned, respect our history, respect that these traditions have been passed down, and start to incorporate, wholer things into those meals? How do we take out meats where there may not need to be any, right? And just make more thoughtful, intentional, better choices for ourselves, and then pass those traditions down to our children. And so it was not just, Natalie, the food itself, it was the mindset and the shift in the mind that has really helped. My kids are asthmatics and have eczema and all of those things. And I remember very much so regularly being hospitalized every winter, at least for one or so asthma attacks, right? And during the pandemic, it caused everybody to really just slow down, right? Fear is a game changer for a lot of people too. But really to be able to take a holistic look at what you're putting into your body and what you are feeding to your children, right? So even it takes a lot of work to break our own cycles of addiction, especially when you're a lot older, but you don't have to create that sort of lifestyle for your children, right? And we know that as adults, we are responsible for our children and what they eat and what they put into their bodies and what we're putting into their minds. And so I've seen just a huge shift with some of our folks who have been introduced to these better produce. Some kids that have come into the world, those pandemic babies, they're different, right? Anyways.
I've got two, yeah, they're a little different.
They're a little different. But just being, versatile with what's on their plates was something that we were able to do. But then we went to elderberry and, sambuco and just being really intentional about the stores that we go to and having a variety. And so small changes now will lead to larger changes later. And so I've seen that happen. And so I think that was the question.
Yeah, no, it was beautiful. And I think, you touched on how, one of the things I know that you did early on, and I think it's something that both of you do really well, is if we're going to do something, I want to understand why, and I want to share that why with my community. And you both do that in an excellent, excellent way. And I remember that first sheeter that went into the boxes that really spoke to what does Black and African American food, what is our food culture? Let's deconstruct that and walk through that with folks. And also recognizing that that might be us learning differently together and unlearning some of those things and relearning and kind of bringing all those things together. And I just think it was so beautiful the way in which you were able to do that as a community, and how, food is often, it's so central to well-being, and it's also a great entry point into talking about other things. It's like the first, it like creates those ripples, right?
Yeah.
That, okay, now we're sharing a meal together, we're eating together,
Breaking bread together.
Maybe then I start to share, some things that are on my mind, emotionally, and things about my mental health or about my relationships, or some of these other pieces. So I feel as though you both have done an excellent job of really cultivating that within your communities in ways that really pay homage to who you are as a community, who you are as individuals, and also really sharing that with others, right?
And I think this is what this combination of all of us being in this together did, right? Like, you know some of the farmers and have connected with them that are at the farmers market, right? And so you have been really intentional, and your group has been really intentional about getting us connected, getting the right information to us. But I feel like even with my brother here, like being able to ask him questions about the motherland, right? Those are some things that I like try to tell people, like when we're not just repeating the same things over, like these textbooks, they don't have the truth. They're not telling our young people the history, because if you grow up thinking that you are just a product of slavery, right? You think that this is the only way that your people have, broken bread. And so it's up to us to demystify, and provide more context to our young people. And so that is a commitment that, like you said, on that one sheeter that I made, yeah, it is truth that I don't know what this fruit is, right? But it's not truth that it's not in your DNA, right? That it's not grown in wild varieties in your country of origin. And so it was really important to me to be able to see our African brothers and sisters with those things in their hands, walking around eating. You don't have to chop it up and have it a part of this meal, or it's just not to look pretty, right? You can try these things, and then once you test it out, you feel that it is a part of who you are. And so there were so many things that we did, to be intentional with that, with like labeling things, providing recipes, like all of those things. So, and then questions like that I had, that has been lost in that. So, yes.
Yeah, beautiful. So I think we've answered some of these other questions. But this is exactly what we wanted to hopefully share with listeners here is really around how community can come together and can really, done with intention, and really building relationships and trust, and being with community, right? And I think everything that was shared today, the ways in which we talked about identifying needs and understanding what people need. I don't know of another way of doing that other than being with people and talking with one another. And, we have a lot of mechanisms that allow us to get a lot of information across. And at the end of the day, that one-on-one conversation and being with one another and not always agreeing, right? And being able to have conversation in dialogue in ways that really help all of us really grow and learn on our journey of understanding, and for this shared goal of really a thriving community for all folks, for all people.
Something you said earlier, it really did resonate with me when you talked about trust-based philanthropy. And that made me think about like trust-based philanthropy is trauma-informed. It needs to be trauma-informed care, right? Yep. And trust-based philanthropy is trauma-informed. And what came to mind for me in our collaboration and our work together is that we all knew and had put our strengths out there on the table very early on in this process with this RISE and CDC and our collective response to the global pandemic. And so very early on in the process, I said, I can't write the grant, I can't do the reporting, I can't do this. I'm on the ground with the people that are most impacted. We're trying to figure out how to keep ourselves alive and serve the people that are pulling up in vehicles, that are sleeping in their cars, that are under bridges, right? And so you said, we can do that. We can take care of the reporting. You let us know, how does it work? Do I need to call you 4 or 5 times so that you can tell me this, and that is what you need throughout this process? We can make it more, verbal, and then we'll translate what we're hearing from you all to the paper, right? And I was able to say that. And so I made me think about like trust-based philanthropy, trauma-informed, what does true collaboration and partnership really look like? And it's recognizing like what your strengths and weaknesses are. And it's recognizing that, like you talked about earlier, Natalie, like throughout the process, you must be committed to that continuous quality improvement, right? And so the feedback from the people will actually, will show up if it actually matters, right? Like you have to be willing to, no matter what the paper said, and the project seemed like it should be, you have to be willing to go beyond that, make some changes, make some tweaks, and say, actually, sorry, funders, this is not working, right? Because ultimately, we all want the same thing. They want good impact in numbers, right? And so it just makes me think of that saying of like, people are always really, really focused on what their intentions were, And I always say, as harsh as for some it may sound, I don't really care about your intentions. What I care about is what your impact is. And so if you're hurting the people that I serve, if you're harming me, like what does your intentions matter, right? And so you talked about the acronym, you said, what did RISE mean, right? But true philanthropy, true giving, true focus on like building a more beloved, a more equitable and sustainable community is really about that commitment of it needs to be informed by the people that it's supposed to be impacting. We need to be willing to change things up right in the middle of it if it's not working, right? And then we have to admit the truth. There's no reconciliation without truth. What has happened? We have to make space to listen to what people want to share with us, first and foremost, and above all else, right? And that is when we're not doing harm. That is when we're staying true to what our commitment of advocacy and centering people in the middle. And so I had to pull that out because that trust-based philanthropy and that trauma-informed and that intention versus impact, those topics were just mulling around in my head.
Yeah, piggyback on what my dear sister said. I think the strength of our organizations, the grassroots level organizations, Wello, We All Rise, and COMSA, is actually seen through that process, that period of time. And we were in existence before COVID-19. We are in existence after COVID-19. So if you look at what we have done during COVID-19, bringing these people together, having a kind of dialogue, demystifying the myth, removing the barriers, making sure that they understand, what the system requires, and they get their vaccinations, go back to work, and life becomes normal again. So oftentimes when Robin was talking about trust-based philanthropy, oftentimes you see within local or even beyond that our grassroots level organizations have, we are the trusted leaders within our populations. And oftentimes, things like funding becomes very much obstacle for us to do a lot. And when you're getting funding, to me, it's more like you have to do a quick fix that's going to backfire again. So those quick bandages and fixes that backfires, it's not something that our grassroots level organizations will create that impact we are all thinking about.
Absolutely.
Now in our organization, we're thinking about the next 3 years of strategic planning. What we want to see is we are seeing these problems that we are solving. We are seeing refugees coming into the country. We will not be without a refugee, whosoever comes in power. And there will be a lot of political things going on within that realm of being a refugee. It's not just a synonym to being racial or whatever the case may be. It's very political. So oftentimes that fear of being a refugee or labeled as a refugee comes with a lot of underlying connotations of being fearful or those kind of things. So how can we, as a, grassroots level organizations, hold hands together and say, like, we are here to support our community. Our communities are, we can talk about historical mistrust. We can talk about historical damages to Black community that is happening as we speak today. But if we talk about them all day long, it's going to be a talk without any fruitful impact. So for us, I think local leadership, philanthropy that is, trying to who entrust with us about the work we do, have to also think about how can they solve this problem together with us. So that we can talk, we are doing the work. We are the ones who are the boots on the ground, but we need the system to understand what we are doing, because we can't talk about this
Not trying to make it their way.
Yeah, and the quick fixes that backfires, my dear sister. That's going to be, it will come back again. So we need an intentional, long-term solutions to our problems.
I'm so happy you both brought this up, because for those folks who may not work in a nonprofit, right? So just to kind of pull back the veil, so to speak, right? Nonprofits are consistently writing grants that they may or may not get, soliciting funds for folks who, right, we're trying to sell why you should
our
invest
missions,
in, sell the missions, right? When some of those organizations, many people are asking for their support. We're working, to get individual donations. Some of us also have, some service delivery where you can actually create a little line of revenue, but nonprofits in and of themselves are consistently looking for the funds to keep them operational.
Absolutely.
And I think what's really unique about what is happening here in Northeast Wisconsin with some of these organizations, all of ours, Casa Alba included, is really trying to speak, we talked about, we want this to be a conversation with funders as well, and to understand why are the mechanisms the way they are. So if you're asking for number of people impacted and the exact activities that we're gonna do, for listeners who may not have written a grant before, sometimes you write a grant 9 months, a year before it might be funded, and you need to articulate all your strategies, 1A, 1B, 1C, all of your action plan. But as you just heard, community is not static. It is dynamic. And so there is potential harm to be done by saying, we are only gonna do this thing, right? When really what we've been speaking to is kind of this holistic and kind of this big hug that each of your agencies gives folks that really sees where they are, recognizes what they might need. And for some people, it might be food, some people it might be housing, some people it might be transportation, some it's all three, right? Some it's those more intentional therapy sessions or different pieces. But the point is, it's different. And so I think there's often this hard fit because we are asked to specifically articulate all the things when we know in our hearts, right, that to truly be equitable and to truly meet a person where they are, we need to bring our whole toolbox to that table, right? And to really think about all those aspects. So I think, as we look to trust-based philanthropy as a potential model, what it allows all of your agencies, what it allows someone like Wello to do is to say, let's be held accountable to how we use the funds. We will show you the impact. But really see us and know that we are going to use these funds in the way in which is needed by our community. And we're going to, if we want that to be community-centered, how those funds flow also needs to be community-centered.
Absolutely.
So I think there's small things that we can do. So if you are in a position that you have funds available, or you're looking at what's that application look like, think about all those barriers and every question or every requirement, maybe start to ask yourself, like, well, why do we need that requirement? Right? What are the things that we need? And we are wholeheartedly like, yes, hold us accountable to those use of funds. We will show you the impact. But let's let people create that impact and continue to do the work in ways that really support the holistic and that full spectrum of things that a community might need.
Because some of them actually might force you to like lie. Like that's almost the truth. Like, what does that even mean? You know, when I'm reading some questions, like we don't know that yet. We're telling you what the vision is, right? And we're telling you what we've experienced thus far, but yeah, what does that even mean?
What does that even mean?
I really like the way you said that the needs evolves, so it's not static. And if you can look at how the needs are evolving within the communities that we serve, we are having communities who are coming into the country right now. Within 90 days, we're talking about mental health, trauma. Do we have that in Green Bay? Culturally responsive trauma? No. Culturally responsive childcare? No, for them to go to work. So a lot of things are non-existent in the system or in our local area. But how can we try to create a way that is going to be more sustainable, more long-lasting? So what I'm trying to understand is how is the whole model of granting, things working right now in the U.S.
Yep.
Is it like the only thing you see for few grants are just given like they are 3 years cycle, but others is just a year or so? What can you do within a year? So it's those are some of the things I think that we need to infiltrate and try to understand as a grassroots level organization. Is that going to be sustainable for us to work on? Like what is the sustainable solution for organizations?
I think this one in particular, they like identified us doing the work in the beginning. Like I don't know if it was Greg from US Venture.
Shout out to Greg, yeah.
Shout out to Greg. Greg, right in the beginning, like, hey, like I met with these community partners. I know that they're doing work on the ground with folks during the pandemic. And so I like folks like that, folks that are like, I remember what's happening, or I'm following, what has been going on in the community around me. And instead of having us to continue to, it's that, top down, top up, that flip again, right? Like what you're saying is, what about, trust-based philanthropy being like, we're hearing about the work that you're doing and we're seeing the impact that it's making in the community, or we're watching the demographic shifts. We're hearing about the needs on this level and we're trying to look for what are the solutions, what are the things that are already happening on the ground, how do we make that, a part of what we do? And so the grantors that are like, hey, can I come and talk to you, as opposed to the ones that are dependent solely on whether you have 6 grant writers in the back that can put a beautiful story together, because I've seen some very, very talented writers, and I've been in front of a grant with all my heart in it, and knowing that this is totally in line with what we're doing and what we're seeing and who is the most impacted right now on the ground, but just not having the capacity to be able to, eloquently and talentedly respond to the question at the time, and when you're doing, like you talked about nonprofits, excuse me, one of the things that's happening, like when you're in a nonprofit, you wearing 6 hats, you know what I mean? And so sometimes we don't have a person that is solely just writing the grants, or then you have these grants that have a combination of all of this statistical data. You almost need a statistician, a statistician to go through and, really look at and an evaluator here, and then a grant writer. And some of us that are on the work, that are on the ground and that are doing the work, we just don't have that. And so we look at things that are totally aligned with, within the same community, the focus population, the demographic areas, the need, all of those things. And the only thing that doesn't align is our capacity to write about it, or even, language barriers, or, who is going to be in that room that's going to be evaluating the work? Will it be people from the same community that your work is saying that you want to fund? If you have the same group of people that's evaluating even things that are happening in grassroots work, but they've never done grassroots, no matter what we'd like to think, they're looking for what they're used to. They're looking for the typical larger agencies. They're looking for places that have all these infrastructures in place and processes and standard of care. But what about, standards of practice, all of those things that are already like clearly defined. But what about the folks that gave way to those that were most vulnerable in the most vulnerable times in our history, So I always say in my community, we knew where to go. There was a candy store lady that did hair, took care of the neighborhood kids that were most vulnerable. If there was family members that were impacted by, violence or just poverty or anything for that matter, there was people within our communities that you knew where to go that would keep you safe and all of those things. But she surely knew what was happening in all the households and.
And that's what both of your agencies do for members of our community. Well, this dovetails beautifully because during our next episode, we are going to dive a little bit deeper into systems change and really ensuring that they're healing and trauma informed as well. So as we close out this episode, we talked a lot about the COVID-19 pandemic and vaccinations. Yeah. We did want listeners also to know that if you or someone you know is in need of a COVID-19 vaccination or a booster, but you may be experiencing current cost or insurance or other barriers, we do have at our local CVS and Walgreens here in Northeast Wisconsin, through something called the Bridge Access Program, you can get access to these vaccinations for free at no cost for you or your family. And you can also go to vaccines.gov for further information. Also, you've heard from each of these agencies as well. And so if you have questions, know that we are here to answer those questions, to be here. We were here right in the beginning at 2020 when we were in the thick of it. And I hope that one of the things that you leave this conversation with is recognizing that we're still here for you. These agencies are working day in and day out for you. So it is a welcome sign on the door for you all. So we hope that you'll stay with us. And until next time, thank you for joining us on Building Equitable, Thriving Communities.
Oftentimes we embody as an organization hope for those who fled their countries. A hope to an extent they will be okay in where they are.